I'm Mandy Ashley. I'm the Executive Director of the Aurora Health Alliance. This is our fall quarterly community meeting. Welcome. And I want to take a moment right now to acknowledge our affiliates who are listed on this slide. We couldn't do our work, especially during the pandemic, without you all. So thank you so much. If you're interested in becoming an affiliate, send me a message. We'll get talking. Next up are our panelists.
Thanks everyone for being here, and thanks to our speakers. We have 3 folks speaking today on the unhoused work that they do in the community. We're going to start with Marlo Alston with Ready to Work, and then Lieutenant Carl Esquivel with the Salvation Army, and then we will end with Tamika Nuamah with the Aurora Day Resource Center, which is a program of Mile High Behavioral Health Care.
Thank you. Good afternoon, everyone. As you know, I'm Marlo Alston. I've been with Ready to Work Aurora for about 5 months as their Community Relations and Development Manager. I've been doing this work for, goodness, decades regarding homelessness as well as mental health. Speaking of local politics, I also sit on City Council with the wonderful city of Centennial. So I am also on the ballot on November 2nd. I've started my little timer here, and I'm gonna kind of go through a couple of slides fairly quickly. Bridge House is a transitional style home for our homeless neighbors here in Aurora and the surrounding cities. If we can go to the next slide. Our model with Ready to Work is housed up under the umbrella for Bridge House, which is located in Boulder. We have a Ready to Work house also located in Boulder. And the one that I'm talking about today that I specifically work out of is the Aurora location. We're located right off of Parker Road and Peoria by 9 Mile. And just to go into this holistic model here, I'm not going to read each slide word for word. However, we're taking a 3-step approach, which we like to just say it's our 3-stool model. We are work first model, support, and housing. Work first is what we believe that people need in order to be successful in coming out of homelessness. And with that model, when we take them through the interview process, we figure out, are we going to bring them on as an intern and see if this is going to work? We get them to working immediately as an intern within the house, doing things, whether it's surrounding the house on the grounds or inside the house, cleaning the bathrooms, their living spaces, the kitchen, things of that nature. We have 2 enterprises. One is outdoors, landscaping type of work, and the other is in the kitchen, where we have Dinconia's brownies, where they're in there, they're doing the work. They're packaging the brownies. They're also cooking the brownies and things of that nature. So we pay them for their work. Again, our social enterprise is a stepping stone so that when they finally get to the final step, which I'm going to go into regarding the housing, they're ready to go out into the community and find jobs, whether it's in finance or back in schools, whatever they choose to do. They have developed those skills and had the opportunity to save funds while they're in our house to go out and be able to go on their own. The supportive services that we offer as a 3rd part of that stool is evidence-based. We talk about addiction. We talk about case management 101 and what post-graduation looks like in our aftercare program. Next slide, please. And as I stated, this is an evidence-based approach to addressing homelessness within our communities. Colorado Ready to Work is the only program in our state that has the model that we have. Again, we pride ourselves on this being evidence-based. You give someone a job first, you teach them how to save money, you at some point allow them to start saving money and paying back a portion of what they're earning so that they're used to earning the money, saving the money, and also paying their bills. And again, we are located on the corner of Peoria and Parker Road, so it's very centralized to Aurora. And we are also looking at expanding out into the Tri-Counties area. Ready to Work, again, first stepping stone to being able to manage your life as an individual. People are normally in our program for up to a year. They graduate, which we're having a graduation tonight, celebrating the 2021 graduates. Our graduation consists of, at this time, 72% or better. So today we'll be having a virtual graduation, and I'll put that information in the link so that everyone can tune in. It's free. Please share it with your colleagues and help us celebrate these men and women that have successfully graduated from the program and will be going into their own homes. Next slide, please. The impact of our program, other than it being evidence-based, which I cannot talk about enough, is what do they get? What is the return on investment? I wanted to make sure that I talked about this a lot. Not only are we housing people from off the streets or from couch surfing, our Aurora house has 50 beds. The Boulder house has 44. So we're able to house 50 people at our transitional house. Men and women are on separate floors, and then we have the community floor on the third, where we have our meetings, the house meetings, where the lunchroom is, and where so many games and workout areas are housed at our location here in Aurora. So quickly, I have about 2 minutes. Again, can't brag enough about how successful the program is at 72% graduation into mainstream employment. 85% in 1 year are still in their own homes and maintaining a job. And again, the cost of the program, as in opposition of someone being on the streets, is we are doing this at about $28,000 per graduate. And the final slide is basically just giving you our address and letting you know that we're at 3176 South Peoria Court in Aurora, and telephone number 720-204-1100. Please reach out to me. I'd love to meet with everyone one-on-one to go into details regarding the benefits of this program and what I do on a more personal basis, and why I believe this program is so important. And even more important, talking about people that you're elected into office, that you have people that believe in what your target overall goal is regarding our homeless and those who suffer from mental illnesses. So with that, and 1 minute and 31 seconds left, I yield back to you.
Awesome. Thank you, Marlo. Thanks for the information, and congratulations to your graduates too. How exciting.
Yes,
We did have a couple questions come through, so we have a minute or two for questions. How do people get referred to Ready to Work program?
Great question. So people are referred from different organizations, as well as when our crews go out. We have crews working in the parks. off Colfax, people that just walk in off the street. And when they do that Monday through Friday, we interview them immediately and we're able to bring them in. So referrals come in many different ways, which is why I'm out here doing panels like this to let people know, please use us. We don't have families or children, but we do, again, have places for men, women, or people that do not subscribe to a gender conforming type of situation where they can select where they feel most comfortable. So referrals come from everywhere.
Great. Thank you. And then one more question. How can community organizations support you in the work you do?
By referring, by telling people that we're out here, that we have a model that works, by putting people to work, because working does work, even if you're not, that was my timer, even if you're not homeless, we know that if we don't work, things happen just on a personal level within your home. And that's why we believe that putting people to work and giving them that confidence to get back to where they once were, and even better, that they can be successful. So by referring people to us and helping to get people off the street and not trying to reinvent the wheel and trying to figure out where to send people, that helps. If you know of grant opportunities, that helps. If you know of an organization like Thanksgiving and Christmas is coming up, I'm in the process of trying to figure out a meal for our residents in our house. If that's a service that you can help with, let me know. And I'll do the same for you. I met with Salvation Army in a brief call, and I know that they accept families and older populations. That all helps me when someone comes in and we say, we cannot accept you into our program. However, let me refer you to, and be that connector. And so that's how we work best together. And I also do that with Change the Trends. If you've never worked with them before, they're a great networking place to meet with other organizations that does this work. And also go before your council and let them know that you're out there and you're doing the work. And it takes more than just a complaint about someone being homeless. It takes using your voice and letting people know that you need your city's help and resources to do so.
Absolutely. Thank you so much. Thank you for your time and for the information. You heard her. Refer, get the word out, make connections. Thank you so much, Marlo. Okay, next up we have Lieutenant Carl Esquivel with the Salvation Army. We have your slides ready for you.
What a privilege it is to be able to just share with you guys this amazing program. So at the very hit of the pandemic, we saw that the homelessness issue began to really rise up here in the city of Aurora. We saw encampments. And then one of the issues is that the homeless have, due to the pandemic, there has been a reduction in services, and meals and things like that. So one of the things the Salvation Army did is partnered with the city of Aurora in order to come up with this safe outdoor space. What is the higher need of sheltering, right? Because at the end of the day, we can do nothing by our own. It takes partnership, it takes commitment, it takes working, collaborating with other organizations. And you can see it clearly in the slide. What does this look like? So these are winter weather shelters, and it serves about 35 people, 37 people at a time. It's very clean, it's 24 hours. We see who is this space for. It's for the unhoused friends, including couples, singles, pet owners, LGBTQ+, people with disabilities, and more. So this is an awesome temporary safe space. So was a pilot program, and it started in July of this year. So it's fairly new, a couple of months new. Now, it has been extended until May 2022. So that actually just came down the pipeline. That is actually good news because it's working. Just as Marlo was talking about, it is working. So this is a housing first model. So it is intended to provide a safe place for the people to be at, and it encounters the services and resources to the individual through relationship building. So we host them, there's case management, and there's a couple of organizations. We see the guidelines there. There's no violence, no theft. You can see the protocols. What kind of services are there? There's daily wellness screenings, COVID testing, vaccine access, hotel referrals, outreach services, housing referrals, employment referrals, and there's so much that goes into it. So currently, we're located on the warehouse of the Salvation Army on 33rd and Peoria. The location serves around 35 folks on average and supplies shelter via 27 cold weather tents. The site operates 24/7. So it's an all-encompassing service, and the focus is housing and case management. What this looks like, it's meeting folks where they're at to provide housing and employment referral, benefit navigation, connection to primary health care, and behavioral health care, as well as the Aurora Health Alliance can definitely attest to. Other necessities such as food, water, shower, and restrooms. We do this through numerous partnerships with the community, public health department in partnership with the city of Aurora Housing and Community Services. If we can go to the next slide. Did it freeze? Oh, yeah, there it is. So successes, you can see it here. I don't really want to waste your time and I guess continue to brag a bit, but it's a fantastic program. Success: housing diversion solution for guests and community members, housing people. That's the thing. Providing that safe place. It's not sustainable to continuously just allow people to just do encampments in the streets. So we recognize that is a need. So guess what the Salvation Army did? We pivoted and we provided that space. Again, this is not by force. This is just by people, us extending a warm and open heart to them. So guests actively engage in case management. Qualifying guests are enrolled in one home. Decrease average time guests spend in shelter through linkage with community resources. So again, very much linking the individual with the resources available. This is rental assistance. This is housing. This is a ton of things. So current outcomes for this year, we have sheltered up to 80 people, and this is just in 4 months. So housed. Family reunifications, it says 6, but it just increased to 11. And independent housing, 4. Housing assessment in one home is 44. Employment connections, 11. This means that in 4 months, 11 people have been hired and still have a job until this day. So benefit connections, 36. So let's go to the next slide. So what's next? So in this program, it is our intention to convert these winter tents into pallet shelters, and it's a little bit light, but you can go to, I have the address here. You can go to palletshelter.com to read more about what this looks like. So it would house 2 people. So if they are a couple, there's 2 beds for them to stay at. So these facilities are super clean. I think Rich McLean, who is here, can attest to that a bit as well. It's clean. Some of the things that people people kind of talk about is okay. Is it dirty? Is it filthy? No, I would welcome you if you would like to go on a tour with us. Just shoot me an email and we can give you a tour of the facility and what it looks like. One Home is an optimum care program that connects folks to other housing programs that they are eligible for based on housing assessment. So we really assess the individual person's needs. It's not a generic thing, oh, this is where we're going to put you. No. So we want to see what are the needs of the individual or the couple and meet them where they are at. So we'll try to avoid the generalization of the population and really do specific services for the individual. And with that, I will end and I will open up myself for questions.
Great. Thank you, Carl. That's great. We love that. Meet folks where they're at. Sounds like the program is going really well. Very excited to hear that. We did have a few questions come through. One of them is, can you explain what One Home is?
Yes, so One Home, So One Home is a program that really assesses the individual person's housing needs. Let's say a person can't really completely take care of themselves. So what is their need per se? Do they need home care? Is it that the person just needs a place to stay and so it's things like that the program really assesses. Again, it's in an individual basis. That's what it's about.
Great, thank you. Another question is, on average, how long are people staying? How long are they allowed to stay? Can you give us some of that info?
So they are allowed to stay as long as they need. This is, again, a place of shelter. It's a place of safety. So we unless there's behavioral issues, as stated in one of the slides, they are allowed to stay. There's case management. For most part, no one has really stayed for more than a month and a half. Again, there is a turnover. People are accepting services. They are accepting resources. So that's kind of how this SOS works.
Great, thank you. And then, are you following folks once they've left? Do you follow what the next resource is that they've been connected to?
Yes, so that's the amazing part of this program, that they're connected through our database. So there's constant case management. So even though they have kind of moved on, we still keep tabs on them every month to see where they're at, see if they have fallen back, if they need rental assistance, what are the circumstances. So there's not only us providing the services and then letting them go, but we still walk with them until they feel they no longer need it.
Thank you. And we'll do one more question that came through in the chat. Is there a wait list, or how many openings do you usually have at a time?
So usually there is about maybe 5 to 8 openings at a time because of the turnover. There is a waiting list. If we reach max capacity, there's definitely a waiting list. We refer them to different organizations and services as well. We continuously keep tabs on them as well. There's information and still do case management with them, even though they might not be in our location.
Great. Well, thank you very much. Thanks for the work you're doing. Yeah, great. Thank you for being here. We're going to move on to Tamika with Mile High Behavioral Healthcare. We have your slides ready to go, Tamika.
Hi, everybody. I'm Tamika. I'm the program manager with the Aurora Day Resource Center. I've been with Mile High going on 5 years in January. So I just wanted, you can go ahead and go to the next slide. The picture is Robert Dorsheimer. He's our CEO. A lot of people knows him already. I've seen that in the messages that I was getting. So our values is like empathy, respect, caring, safety, stability. We have 3 different programs on the, we call the East Side. So we have programs down in Denver too, as well as Aurora. Our host team is on the East Side. We have Comitis Crisis Center, which is the shelter. Thank you for slide changing. We have Comitis Crisis Center. That's the shelter where they're open 24/7, 7 days a week. We have different programs inside of Comitis. We have the VA GPD program. We have the TANF program, ORU, and then we have our singles and overnight families. Singles are allowed to stay at Comitis for a month. And that's run by a lottery system. So they would apply for the lottery in the last week of the month. If they make the lottery, then they'll get in for a whole month. Overnight families is, we say overnight, but they have a week they can be with us. We don't really too much go off of like the typical family setting. So if there's an aunt and grandma with the child that's under 18, they're welcome to come to us. And then we have the Aurora Day Resource Center, and that's where I'm the program manager. This Aurora, we call it the ADRC, excuse me. It's open 7 days a week, including holidays from 7 to 5. Here they can get showers. We serve 3 meals a day, breakfast, lunch, and dinner, but we're always feeding people. If they come and they've missed breakfast, we're gonna make sure they have food. They can do their laundry here for free. We provide the soap. We have computers, case managers. Aurora Mental Health also comes. We have a visiting dentist that comes every now and then. Let me see what else. We just hired a new employment specialist. So she'll be coming and working with people with that. Here we try to focus on getting people their basic needs to move on to other programs. And then we have COFAX Community Network. That one is more based on families. They have an after-school program. They have a drop-in center Tuesdays and Thursdays from 10 to 12. There they can get ID vouchers. We're working on securing birth certificate vouchers as well there. Clothing, you can get clothing at either one of our centers here. They also have case management and I don't know if I said the after school program, but yeah, they have an after school program. The cutoff age for that is 12 years old. They take them to do things like they would normally never get to do. So that's really cool. They have a STEM lab in there that they just got, showing them how to do 3D printing and stuff like that. So it's really awesome over there. And then we have the street outreach program. So outreach is here. They work 4 days a week. They're out trying to get people to come in and receive services. They'll also be part of the ACAN team. I don't know if you guys know what that is, but when it is cold weather, we team up with Aurora Warms Tonight and Aurora Mental Health. Usually, I think it's going to be different this year. And we try to get people in the shelter and not be out in the cold. We also activate the Aurora Day Resource Center on those cold nights so that we will be helping out with sheltering during the cold weather. think that's all that I have.
Great, thank you. I did see a couple questions came through to me. You mentioned case management at Aurora Day Resource Center. Is there also case management at Comitas?
There's case managers at both, well, all three, Aurora Day Resource Center, Comitas, and COFAX Community Network. Only because Aurora Day Resource Center, you have to be 18 years of age to come in here. So guests with children can go to COFAX Community Network, and they'll have a place for the kids to be while parents can get resources.
Great. Thank you. And we did have a question come through. Thanks, Rich. When Comitas or Safe Outdoor Space is full and people need shelter, what do you do?
We'll activate the ADRC. The ADRC, you guys are welcome to come take a tour. I'll put my email in the chat. It's an old APD gym, so it's a big open space. We're looking at doing 75 this year at a time, although we wouldn't turn anybody away if it's cold outside and we're activated.
Sure. Thank you. Other questions? Awesome. Thank you so much for the information. It's really helpful to see all these resources and all the work that is being done, especially as we get into the cold weather season.
Right.
Any other questions for any of our speakers so far we didn't get to? Right. And Allison, I see you hopped on. Thanks for joining. We'll move on to your presentation.
Thank you to our panelists, and thank you to all of those who have been participating with the Unhoused organizations cohort. I wanted to take a moment to thank Lana Dalton with the City of Aurora for joining this meeting and for collaborating over the past 6 months or so with us. I want to thank Bonnie DeHart. You have dedicated more than enough time towards the unhoused issue. So Bonnie is on our board. We are so grateful to have her, and her heart just goes out to the unhoused, and we try to live like you do, Bonnie. Thank you also to Rich for being on our board and also with the Salvation Army, and dedicating a ton of time to this issue.
And this is Allison Summerton. I am program manager with Connect Aurora, and we are a health insurance enrollment site. We are certified by Connect for Health Colorado. And I am here to tell you about open enrollment. And usually I see you at this time of year to tell you about the Connect for Health Colorado programs. So Connect for Health Colorado is a program within, Connect Aurora is a program within the Aurora Mental Health Center. It's a community service of the Aurora Mental Health Center. We help people with Connect for Health Colorado Marketplace Health Insurance, Medicaid, and CHIP. So what's unique about Connect for Health Colorado Insurance? Connect for Health Colorado Insurance is for people who do not have coverage by an employer, or they're not eligible for Medicaid, or Medicare. So we provide assistance for people who would normally buy insurance on what we call the individual health insurance market. Often these are people who are working in businesses that cannot or do not provide health insurance, people who are self-employed, working as contractors, and people who are working maybe more than one job part-time when neither one of those jobs offers health insurance. So Connect for Health Colorado has an open enrollment period every November 1st to January 15th. And during that time, people can enroll in a Connect for Health Colorado plan, or they can re-enroll or change the current plan that they already have. Next slide, please. Thank you. So one of the amazing things and what is unique, this is the 9th open enrollment for Connect for Health Colorado and the marketplace plans since the Affordable Care Act was passed. And this year, we have more financial assistance available for customers than ever. That financial assistance has been provided by two programs. One, the federal program is the American Rescue Plan, and the American Rescue Plan provided extra financial assistance that would help people reduce their premiums. So this financial assistance was available for 2021 plans and 2022 plans. As you can see, for an individual earning a little over $19,000, that's around 150% of poverty, that individual is eligible for a $0 silver benchmark plan. And for an individual at 250% of poverty, you can see that their premium due to the financial assistance by the American Rescue Plan would be reduced $100. So premiums are lower than ever before in Colorado. And then there's one more very exciting program that's offering financial assistance, and that is the Health Insurance Affordability Enterprise, which was passed in 2020. And the Health Insurance Affordability Enterprise was a program passed by the Colorado legislature and signed by the governor. That program is directing some state money to help reduce the co-payments and deductibles. So the first population that's going to help in 2022 programs will be people between 150 and 200% of poverty. That program will significantly reduce the co-payments and deductibles. So what would be a normal deductible for a person at 160% of poverty this past year would be maybe $1,000 for the silver benchmark plan. That will be down to $200 for 2022. That is a really significant reduction in the deductibles, as well as the co-payments to see primary care or a specialist are also significantly reduced. So this is a very exciting year. And the Health Insurance Affordability Enterprise will next year for 2023 insurance programs be also helping to provide subsidies for undocumented individuals and families, and will also provide subsidies for people stuck in what we call the family glitch. So that's the Health Insurance Affordability Enterprise. This is the first year they're providing benefits, and it's going to be growing in future years. So it's very exciting. Next slide, please. So Connect Aurora, we can easily be found at connectaurora.org. We provide assistance, health coverage guides in Spanish, English, Farsi, Amharic, and Arabic and French. We also use the language line. We can assist individuals who speak languages other than those languages. Our partner is the Aurora Community Connection, and we provide enrollment assistance at in-person enrollment at 3 locations. That would be at the Aurora Community Connection, at our location on 6th and Chambers, and another location on Parker Road. We also provide appointments virtually. So those appointments, we can provide assistance to people on Zoom, and if someone is not comfortable coming in person, or if they live out in Bennett or live someplace that they don't really want to drive, we can provide assistance virtually on Zoom. So the best way to reach us is to go to connectaurora.org. You can schedule appointments using the tool on connectaurora.org. And we are now scheduling appointments for November 1st for open enrollment. Now, of course, I'm focusing this conversation on open enrollment because Connect for Health open enrollment begins November 1st, but we do assist all customers all year round with Medicaid and CHIP, and also for individuals who have a life change event. For example, if a customer is earning over the Medicaid limit and losing Medicaid, we help them enroll in Connect for Health Colorado. The same is true if an individual loses their employer coverage and they're eligible for Medicaid. or CHIP, we help them enroll their family members in Medicaid and CHIP. So we're open all year round, but I'm focusing today on open enrollment because it is the unique opportunity to enroll in marketplace coverage between November 1 and January 15th.
Thank you, Allison. 'Tis the season,
Tis the season.
for open enrollment.
It is, it is. Happy to answer any questions. I think I saw one come up.
Yeah, we've had a few questions come in. One of the slides, I think was maybe the second slide, said 40-year-old Aurora resident. Is there an age qualification for the ARP?
Oh, not at all. I just provided an example because all the premiums on health insurance on marketplace and off marketplace are based on the age, where you live, and your smoking status. So those three factors influence your premium. So I have a whole table I can provide anyone. It is based on their age. I use the Connect for Health Colorado insurance tool to estimate those premiums, but any individual can go to Connect for Health Colorado and explore the cost of the programs themselves. We are happy to help with the enrollment. There are this year almost doubled the amount of plans on the marketplace for the Denver Aurora area. So there are now going to be 144 plans available. That can be a little overwhelming, which is why we're here to help.
Great, thank you. Another question around undocumented folks who are not eligible for ACA health insurance. Will that change?
Actually, so this year, an individual is not eligible for financial help for the ACA plans, but Colorado has passed legislation which enables undocumented individuals to purchase insurance directly with a carrier, and Connect Aurora can help you with that too. We work with brokers, or we will go directly to the carrier to help an individual with that application. Unfortunately, that individual or family is not eligible for financial assistance yet, but next year, due to the health insurance affordability enterprise, there will be subsidies for individuals to get to apply to their Connect for Health marketplace plans. Now, the federal government does not allow financial assistance for undocumented individuals. So what Colorado has done is created a public benefit corporation, which allows them to create a parallel program to enroll people who are not eligible for federal financial help to enroll in the program here in Colorado. And that also goes along with folks who are not eligible for financial help because they are offered employer coverage. And there is a problem called the family glitch. And what that means is if there is an individual who gets employer coverage that is affordable for them, but it's not affordable for the family members, that family currently is not eligible for federal financial assistance or advanced premium tax credit. We've dubbed that problem the family glitch. The Health Insurance Affordability Enterprise is going to provide financial assistance for those families next year. We're very excited, but unfortunately, again, that will be implemented in 2023.
I don't think you can underscore enough the importance and the excitement surrounding this enterprise. That's
It is very exciting.
Next year, I'm
Yes.
in awe. I'm learning about it. My brain is ecstatic about how we can help share that coming up. And there were a couple more questions. They're rolling through the chat.
Yeah, someone asked if you help with SSI benefit applications, and if not, where would you refer folks?
So individuals, yes, legally we cannot help as SSI. Those applications really need to be made directly at the Social Security office or on ssa.gov. There are, for people eligible for SSI, there is Medicaid offered to those individuals. It's actually dual enrollment. When you apply for SSI, you get Medicaid as well. For individuals who are eligible for Medicare and those who are either elderly or disabled, there are Medicaid plans that help with those low-income Medicare recipients, and we do help with those programs.
Great, thank you. And then Question from Mary, is the assistance to sign up for plans for those who are a certain percentage of the poverty level, or can people who just need a plan, but who are in the middle income able to get assistance?
Oh, absolutely. So I can't stress that enough. We help anyone who walks in the door. Even if an individual is asking about Medicare, we'll help connect them. We'll help them educate about Medicare, and then we'll help get them in contact with trusted brokers that we know will help them choose a supplemental plan or an advantage plan that would be best bet for that individual. So anyone walking in, again, if you have an undocumented individual or family, we're more than happy to work through, find a program that would work for them and either go directly to the carrier or refer the individual to a broker. We also do referrals to sliding scale health clinics. So we really welcome everyone who has a question about health insurance and very much are interested in helping people learn to use their health insurance. So we do provide a lot of health insurance literacy. We do follow-up important appointments to help people learn how to use their insurance, how to find providers, how to talk with their doctors about the right kind of care. So we do provide a lot of health insurance literacy as well.
Great. Thank you so much. Thanks for the really important information as we slide right into open enrollment period.
I'm just seeing a question from Brandon. Is it available for young people who are not able to be on their parents' health care? I believe so. Yes.
And when a young person walks into the house, into our office, we will do initial screening to figure out whether they are eligible for Medicaid or Connect for Health Colorado, and then we help that individual apply for the most appropriate program for them as well.
Perfect.
One thing I forgot to add, as also part of the American Rescue Plan, that there is no longer an income cap for which someone could be eligible for financial assistance. So it used to be at 400% of poverty that no one was eligible for financial assistance. That cap has been removed. The financial help is available to anyone over those incomes if their premiums are greater than 8.5% of their income. So you can have a single individual who is older, who has a higher premium, who is earning $55,000 a year, and they're still eligible for financial help.
That's amazing.
A lot of exciting financial assistance this year.
When you outreached us, you said there's so much going on. I've got to have time, and you delivered.
There is good stuff going on in health insurance this year.
So thank you so much, Allison.
Thank you for having me.
Thank you all so very much.